Welcome back to Breakfast Television. Dr. Zach Levine back with us this morning talking about a very important topic, and that is suicide. It is World Suicide Prevention Day. Dr. Zach, thank you so much for being here. Really appreciate it.
Yeah.
You know, the numbers are staggering, Dr. Zach. Let's start with some of the numbers. I hate to start, on something like that, but I mean, it is pretty frightening.
It's terrible. Quebec has the highest rate of suicide of all the Canadian provinces, unfortunately, about 1,000 a year, so a little less than 100 per month.
Right.
And I think the importance of this day is making people aware. There's a lot of suffering around us, and I think many of us care, but we're just busy with our own lives, and maybe we don't reach out, and maybe we don't check in with our neighbors. It makes me think a little bit of the heat wave when people were dying, and it was mainly people who were isolated.
That's right.
And there are a lot of people who are isolated, and a lot of people who are suffering who we don't realize it, because we're so busy, or they don't talk to people, and it's one of our jobs as a society is to take care of people.
When we look at those numbers in Quebec, who are we seeing that's most susceptible?
The most affected are men and Indigenous people, Native people. Now that's not to say that women don't. In fact, women have a higher rate of suicide attempts. They just fortunately don't die as much, and I think part of that is because men use more violent methods of trying to kill themselves, like guns. So that's one of the arguments for gun control.
Right.
Which, I think, luckily we have some here.
Yeah,
but
it's a good point.
Another thing, one of the other things that it brings up is just having access to mental health services. And that's something that, having access to it and knowing about it, and for those of us who work as first-line providers, is to try and recognize, but not just us, anyone, try and recognize signs that someone is changing, that someone is suffering. And then AMI Quebec has some great resources. If you look online, they have all the different sites that you can go to and telephone numbers for people who are having dark thoughts like this.
You said recognizing signs. So let's talk about some of those signs. What are some of the things we should be looking out for?
So definitely, if you notice a big change in someone, so a big change in their sleep, a big change in their appetite, if they're not doing what they normally do, they used to, play hockey every Wednesday night, they used to, or they stop going to work, that sort of thing. That's a concern. That's not to say they're suicidal, but that's a concern. It's a reason to reach out to someone. Other reasons you'd be concerned is definitely if someone starts talking about suicide. If they start talking about death, they start talking about hopelessness, they start giving away their things, they start really seeming to be apathetic and not caring about things. Those are reasons. Again, it doesn't mean they're suicidal, but it means it's something to be worried about. And especially if you happen to know that they have any risk factors, if you know that they have mental illness, if you know that they have, if they've abused drugs or alcohol in the past, if they've been in contact with someone who's committed suicide, those are all things that make them at increased risk. The other thing I should mention is the two peaks in terms of most common times where people commit suicide are between the ages of 15 and 24 and over 60.
Okay.
So again, it's not everyone within those groups are the people who do it, but they're just concerns. These are risk factors.
You mentioned, yourself and, of course, your colleagues being front of line, and I'm sure, there's training involved for you to recognize. But, as a whole in the healthcare field, when you look at the amount of money being allotted to mental health, it's still very low when you consider how prominent it really is. Are governments doing enough?
Well, I think, we could always do more, for sure. And I do think, it's worth saying that over the past, I think it's about the past 10 years, Quebec has come up with an anti-suicide strategy, which has decreased the rates significantly. And, but having said that, could we do more? Absolutely. And I do think there's been some success in also decreasing stigma, because one of the problems is people suffer in silence.
Yeah.
We were talking just before this about, if you have an illness, a physical illness, that you're going to go to the hospital, you're going to talk to someone about it, you're going to take time off work, but there's still some stigma. There's still a lot of people suffering out there who don't feel they can talk about it.
Yeah.
And one of the protective things is if you feel very connected, if you're in a strong family unit or community unit where you feel loved, you feel cared for, and you feel like you can talk to people. That's protective for people.
Yeah, let's talk about, protection and prevention. Self-care, I would imagine, looking after your diet and exercise. I know we talk about it all the time, but these are really important factors to think about, right?
Anything that protects you from mental illness. So taking time for yourself. And we've definitely talked about, diet and exercise. They're very important. If you're connected, like I mentioned earlier, if you feel connected, that's very important. If you feel you can talk to people, if you seek help and if you have access to mental health services, and On the other hand, if you don't have access to firearms, these are all things that are protective, and those are societal things that the government can help with in terms of access to mental health services. One of the things we can all do is decrease the stigma of mental illness.
Yeah.
And reach out as individuals. That's something anyone can do. And it's not, anyone who works with people, so teachers, clergy, all these people should always be thinking about the fact that people are suffering and not everyone is willing and ready to talk about it.
Agreed. And you mentioned resources we put up right here. Here's help is available, as you can see, help available 24/7. Yeah. And I know there's a lot of young people out there that prefer to communicate through text. So, of course, yes, that's available in so many of these hotlines as well. Dr. Zach, thanks so much for joining us. Really appreciate it.
Thank you.
Of course, lots of information to digest in Dr. Zach segments as usual. So btmontreal.ca, click on our blog section, and you can find out more information. We'll be back with more BT right after this.